You're listening to the Brian Crabtree Show on demand. Catch Brian live and local. Weekdays starting at 4 on Biz 1190. Replay at 9 p.m. on AM 920 The Answer. Details at biz1190.com.
Joining us now to talk about really your health care, and really your finances too, because it all kind of comes together. Mike Iverson, SnellingWalters.com, Snelling Walters Insurance here in Atlanta. Good to have you back.
Good to be back, gentlemen.
All right, so not a big amount of development on the front of Obamacare. There's this looming thing of where we're coming out with something, and we've heard little bits of bills. Do you think it should be a little bit more formal at this point? Or are you a little concerned about what's happening with the fixing of Obamacare, the repeal and replace, or are we just impatient?
I think we are impatient. I think in the perfect world something's happening, but right now you got a little bit of the game called chicken between Democrats and Republicans up in D.C.
So are you optimistic something's going to come out, and are you optimistic just from your reading on this that something will be good for America, or pessimistic on all fronts?
Things are coming together quickly. I think right now what you see is a bunch of bills on the Hill that are starting to merge. And what you have is you have the Republicans working away at Democrats to somewhat leave the party because the party said, hey, we're going to take a hardline stance against. And you have them eking away, sort of chipping away on those rocks, saying, all right, who can we get to recruit? Because they want Democrats and Republicans signing on to the bill.
So your hypothesis here, I haven't thought of it that way, is that the reason the Republicans seem to be the do-nothing Republicans of the past now in the present, even though they control everything, is that they want to work on some Democrats, get at least a few to buy in, so they don't do to America what the Democrats did, which is just shove it down our throat. Is that, you think that's the reason that there's not anything formal out there yet?
I think healthcare is a messy fix, period. There's going to be blood. No matter what happens, there's going to be some issues that come out of any fix. So any effort to make it better, there's going to be some results that aren't better for certain individuals. And so right now you have something which the Republicans say, we want both sides of the aisle coming together on this. And you have Democrats saying, well, then don't do away with our original bill because we still want credit for that. And that was a one-sided, lopsided bill, and it had no R's on it. And that's a real problem in D.C. when it's supposed to involve both parties to come up with a solution.
Mike Iverson with us, expert on insurance, SnellingsWalters.com. As I'm listening to you talk, I'm having a moment where for once I might have a fleeting thought that Trump is right in his inference that perhaps it would be best to just let it collapse, and then there's no choice but to let the Democrats own it, and then the Republicans swoop in and fix it. So anything they do would be better than what we have now, or what it would become as its death spiral is occurring. Would that be a viable option, to give it some time, let it choke a little more so that the Republicans don't have to own some of the new damage that will inevitably occur as they come up with another plan with unintended consequences?
I think the common thoughts on the Hill, there are some people up there right now who would say, you know what, let's just put a horizon date on it. Let's say right now ACA is completely gone away in two different tranches. 70% of it goes away in the next 1 year, and in 2 years, the remaining 30% is completely dismantled. And what it does is it creates a date that everybody has to work toward to find solution. And I think if we don't see movement in the near future, we're going to see that start to occur. We're going to see the Republicans just go ahead and push that bill through and say, okay, we gave ourselves plenty of time to come up with a fix between us and Democrats.
So you see no chance that they're going to come out with a bill in April, and in May or June it's going to pass, and then it's going to come into place later in the year. It's going to be a bill that ultimately has some delay time before it actually hits.
Absolutely. You cannot implement such a giant change to our economy. Something that touches virtually every person across the nation is healthcare. And so you can't have something unless you have a work-in time period, and that's going to be built in. I don't care whose bill is being looked at up there right now. That's going to be it, is what kind of event date, and then can we backwards plan from there and allow enough time for it to occur.
Mike Iverson's with us, SnellingsWalters.com. So what are some of the things that a Republican, and this is a little bit of a crystal ball question, but what are some of the things a Republican might put into a bill, or that you hear that might happen, that could actually have some pretty dire unintended consequences, but we got to do it? Those kind of things. We got to do it, but we're going to do it, and then some people are going to get hurt. What is an example of that?
I think the biggest issue that's going to be hanging out there right now is Democrats and Republicans want to do away with the penalties, but the penalties are crucial to pay for the subsidies that are occurring. So how do we keep people who need subsidies on the plan. And that's the rub. How's it going to be paid for? That's everything on the Hill right now is how's it going to be paid for?
Is it better to put the people who need subsidies just on Medicaid and let that be that way they've got their single payer for the people who can't afford it? Or is it cheaper to give them the voucher and let them go shop for their own insurance? What's your take on that?
In the end, driving behavior is you give somebody the money. It's no different than my kids going out to eat at night when I say, hey, do you want $1? Or do you want to go ahead and pay 80 cents and I'll give you $1 and you can have the soda for $1.80? They always take the dollar from me and they order a water. So when it's their money in their hands, most people, right? There are some people who are unable to make their own decisions, right? Joey, for instance.
Yeah.
I'm concerned about his ability to make wise decisions if you gave him $1. There's always some of those people in society, but the vast majority know what they're doing with money.
That poor child he's had in the last few months, he told me yesterday, he says, I just realized my life has changed so dramatically. I said, no crap.
Yeah.
Wait till you have the second one.
Oh, it's deep.
Yeah, he's like going to bed at 9 o'clock at night. And I used to stay up, drinking and everything, partying until 2, 3 o'clock in the morning.
I'll tell you one thing, though, Brian, that jumps out at me. And it is the thought, and you hit on it earlier today in some of your discussions, the government running programs. There's a distinct difference between a lot of Republicans and Democrats on this. Republicans would say, you know what, employers do care about their employees. Employers tend to make a more responsible decision than employees. Republican plans are designed to empower employers and employees and to empower that distribution of health insurance, whereas Democrats, it's been through the government and let us consult.
That's true. Now, do you think the employer plans have better results than the private plans that self-employed people or people who don't have employer insurance? Are those better plans? Do you have better results, better health care, lower costs? What's the result there compared to the individual market?
My quick answer to you is no. I don't think they have better results. I know employer plans have better results.
And why is that?
Because employers tend to look at the overall spend, and then they tend to educate their employees better on the plan choices and what they should be doing with those funds. This is a lot different. It's just a huge shift. Let's take 401ks. So I love retirement. How many employees would actually end up with money at retirement saved were it not for a 401k plan that their employer chose for them?
And then even with that, some employees don't take it. I remember the story of Boeing, $90-some-odd million in matching left on the table, but at least more people do it. More people have retirement because the employers coach them and teach them. Does it seem like everybody has to have somebody thinking for them? So as we go down this path, how do we apply that same sort of standard where you don't have people with employment health insurance and they're out on their own? They've got to go to the individual market. They're lost.
Yes.
I have a friend who's married to a nurse, and they came to me to ask me, and they're liberal, by the way. I had fun with this. They came to me and asked me how to pick a plan for their family of 4 people, and I said, well, this is this great healthcare plan you wanted. I said, but I'm going to help you. And they were just lost because it's like going in now, and it's easier now because there's only like two insurance companies offering on the exchange. But when it was 12 of them, it was really hard to figure out what's for me, what covers, what do I get to keep my doctor, which the answer half the time was no. How do we help those people get their head wrapped around and unpack all this?
Yeah, there's 2 groups of population. Some people can self-select. They can do it all themselves. They're bright. They just can. They're going to spend the time, money, and resources to do the research. They're going to figure it all out, and they're going to self-solve, right? There's some people who could change their own oil. No big deal. Easy. Do it all the time. And then there's some people who say, you know what? I'm not going to take the time to do that, and they're going to need expert advice. I mean, this is how we make a living with employers, is helping employers make good decisions that are going to drive behaviors and help their employees succeed in the health process.
Yeah, and the thing about it, though, because I've worked with you guys, so you guys are more in the business of helping people make decisions and happening to profit from it, which usually means you make more money doing that than selling insurance. I don't get you guys as the kind of people that are selling insurance. You're just going out and finding your employers or your individuals that you work with that have higher net worths. You help them find the best coverage and the best product. But the problem someone like me has, and I want you to speak to this for our whole audience, is that if I didn't know you and I just went out shopping for some insurance guy to give me health insurance, I'm better served to spend several hours learning the exchange and buying it myself than trusting some guy that's, down at the level of a vacuum cleaner salesman.
Right.
Sell it, because they'll sell me the policy and say, oh yeah, it's got all this, and look at this, and they'll give me a bullet point thing. And then the first time I need it, the first 5 things I said I wanted the most, it doesn't have. How do we avoid that as consumers? Because unless you can go to a high net worth or medium or high net worth company like yours, or your employer buying insurance, it's hard to find that insurance company that really you can trust.
What's interesting here, I think we all know it. We all know whether a person's trying to sell us something, because they're always taking us to a solution without even identifying the issues and problems that we have. So if you're trying to interview somebody and all they're asking about is how much do you have to spend, well, here's a sign of a problem. If they're asking you, all right, what doctors are important? What are you trying to accomplish? Are there conditions inside of your family? What's important in a network? Who else might you need access to? These are the questions that allow you to better choose plans and how they're going to respond. So I judge agents and brokers on the questions that they ask.
So if they're asking a lot of questions, spending a little bit of time with you, and they're asking questions relevant to your health, to what you need, what your past medical history is, what doctors you're using, they're trying to build a profile so they can go out and find what meets all that.
Yes.
Versus if they're not asking a lot of questions, they're doing a lot of telling, which is also selling. Run. Yeah, run. That's a pretty good.
You should be terrified.
So I want to go back real fast because we're running out of time. Mike Iverson with us, SnellingsWalters.com. You talked about the fact that employer plans have much better results than private plans because the employer spends time formally educating their employees to keep costs contained, to find better coverage, to have better health, all of that. So they're essentially providing an education in addition to the benefit. How does the average individual or small company that doesn't have that, how do we go out and find that education? What's the best resource for that?
I think first you have to find a trusted resource, somebody that you really believe in and somebody that actually has your best interests in mind. And there's some good firms out there that do work with small business and do help them strategically look at things. I think also you just got to know the numbers. And so statistically, let's just go in the marketplace, and I'll talk about a company that we're working with here in Atlanta right now. They spend roughly $4 million a year on the health insurance for their employees, and that's their spend. When we look at how much they're spending on fees to insurance companies, because they're largely self-insured, about $500,000 to $600,000 out of that $4 million is spent on plan designs and implementation, what we call the hard costs. The other $3.4 million is on claim spend. That's employees' dollars and their dollars. So how do we educate employees to make wise choices? And we find often 20, 25% reduction in claims with better outcomes by informing people, but we have to put those resources in front of them. And the difficult one for this particular company is it requires them to build a resource, just like they have safety committees and all the things that they do on work comp. They have to handle health insurance in a similar way and be able to push out that education to the employees. And some companies don't have that resource. And what gets difficult is we have to help them build it.
That's it's magnificent, and it's something I think it's really tough for people that don't have the job. But sometimes people that don't have the job are self-employed. They make more money. They're contract workers, and they've got to go out and figure it out. That's the downside. That's the risk you take for the bigger reward. But I think ultimately, I'm seeing some of that even with the Obamacare plan that I have with Ambetter. I'm seeing them send us all this stuff out, get a $40 gift card, get a Visa card for this, go do that. I don't know if that doesn't work for me, but I think maybe that does work for the average, employee. Does it or does it not? Does that kind of incentive work? Is that potentially the right solution, or is that just the government kind of getting into the health? What's your thoughts on that?
I'm cautious. I'm cautious of insurance company inducements, because sometimes they're just inducing you into what's good for them.
Maybe they're getting a kickback on the services they want me to get. Is that possible?
Yeah,
is it really?
The concept of rebates right now is they're just everywhere. Rebates inside of the prescription drug world, they're everywhere. They're the reason that sometimes you can get drugs free at Rite Aid or Kroger, and they say have this promotion that you get them free. Well, they're not free. They're getting a rebate to cover what would normally be your copay.
And then they're going and applying somewhere for some insurance company or to the government, and we're actually ultimately paying it indirectly through taxes and subsidies and things of that nature.
Exactly. And that's part of the problem with your Medicaid and even Medicare solutions. is in the end we're robbing Peter to pay Paul. There's just two different pockets, but it's all coming from us.
I knew when I went to my dermatologist, because I have a seborrheic dermatitis, I think is how you say it, and it's a condition where your skin gets a little oily and you get little red splotches, and it's nothing major, but I have to put some stuff on my face and body from time to time, and she said, well, why don't you try this one? And she said it's free. All you got to do is it's one pharmacy in Arizona, and you went out and you fill out this coupon, you put all your medical insurance information in, and boom, they send you a free bottle of this $100 stuff for nothing. And I'm sitting here going, I wonder who's getting screwed on this one. It's probably me, but I wonder how many more people are getting screwed on this one. So that's what you and I are talking about. And I'm sure if anyone has had that experience, that indirectly there's all these scams or I don't know, gimmicks that are out there. Maybe scam is too hard, and it's ultimately driving up the cost because we don't get to see the cost we're spending or how it's built and baked in because they're hiding it from us.
Brian, let me ask you this. You don't have to name your doctor, but where does your doctor stand in fees compared to all the other doctors in his or her practice in the zip code that you live in?
About average. About average, yeah.
And how do you know that?
Because I've been to dermatologist. I've had, two good ones and a bunch of bad ones.
And the costs that you look at, is it the costs that they've discounted because of the network, or is it what they actually bill? How do you look at that?
We don't really know what they, we don't really know what they're getting paid.
Exactly.
Because the statements, you get the statements, I need a freaking PhD to read them.
Yes. There's the problem. Can you name anything else in your life that you purchase and you really don't know the cost? When Joey went into the hospital last week with his cholesterol issues, and Lord knows what else is going on with the guy, right? Yeah. When he went in, as soon as he went in, did he know what they were going to charge him? Or did he wait until the bill came?
It was free. It's free, guys.
Free. Can you imagine walking into a retail store like a Best Buy and saying, I want that Philips brand TV, walking home with it, and then a month later they send you the bill on how much they're going to charge you?
But that's what happens.
But that's what we do with healthcare. There's the problem.
But they're not going to change that, though, with this legislation, do you think? Is that anywhere in the Republican speak of this?
It's coming.
Do you really think so?
Yes, I think you're going to see more and more transparency. It's already being pushed down in the private marketplace. This is what we're doing with our employers, is pushing more transparency to the employees, offering and giving them some dollars to do so, whether it's through HSAs or other things where we literally give employees money to spend, and then we allow them to spend it the way that they best see fit, seeing the costs in their areas. We need consumerism.
The best place I ever found myself in healthcare was a Blue Cross Blue Shield health savings account. I pretty much paid for everything to the first $6,000 or $7,000, and it was out of my pocket. I was able to see every cost, everything, because there was no copays, none of this. And I was paying like $5.90 for a family of 4 a month, and this was just before Obamacare. Now we've got a $13,000 deductible. We're paying $800 a month, and pretty much unless it's a generic drug at $20 copay, everything costs money, and you never really know what the total cost is because it's always renegotiated. It's amazing.
And without dental insurance, the cost.
Yeah, I don't have dental insurance because I've never found. I've got to go in with dental insurance. It doesn't work.
Go get your eyes fixed. Anybody who's had LASIK, they knew the cost before they had the surgery done because usually they paid it out of pocket. Yeah. And you got to ask yourself, look at the trend line on healthcare. Look at the trend line on LASIK. Which one has a monstrous trend line? Why?
So LASIK is going down in cost.
LASIK, the technology continues to leap forward, and there's very little change in cost over the past 8 years.
Because it's optional, and the insurance companies don't cover it, and so therefore you know what it is, you negotiate it.
It's also transparent pricing.
That's a great point. I hadn't thought of it that way. Mike Iverson, SnellingsWalters.com online. We always give you your phone number as well because you're running a business.
396-9600.
770-396-9600. Great to have you.
Thanks for listening to the Brian Crabtree Show on demand. Don't forget to catch Brian live and local weekdays starting at 4 on Biz 1190. Details at biz1190.com.